Hi, my name is Duperier, and I'm a surgeon in San Antonio, Texas. I do a high volume of weight loss and foregut surgery. I was asked by Progressive Medical to demonstrate this device and try and make it a little bit easier to introduce it into your practice. This right here is made by Progressive Medical. It's called the Extractor-EZ. It is a single-use device, and the device is designed to go down a trocar, and it allows you to use a laparoscopic knife. You can see here I've deployed the blade. There's a little arrow that's that you can sort of see that's demonstrating where the blade is coming up, and it can be deployed and then retracted, and you can do this multiple times. The design and the idea behind this knife is to allow one to open or cut the fascia without cutting the skin. So your trocar is sitting like this, and the case is over, and you're getting ready to pull out your specimen, whether it's a kidney or a fibroid or a gallbladder or a piece of stomach or a piece of a liver tumor, a prostate, whatever a solid organ you're operating on. So the trocar is sitting like this through the abdominal wall, and you can put this device down and then retract the trocar up, and then you deploy the blade, and then you can very nicely cut the fascia in one direction. You can turn it around if you wish, and then deploy it again, and then you cut the fascia. And then once you retract the blade, you can pull it back out without damaging the diaphragm of the trocar. And then you can more easily remove your specimen. Now, sometimes you can use the knife without using the trocar, and a little bit more difficult to visualize, but what you would do is you would just put this right down directly adjacent to your specimen bag on the inside of the skin, and you would orient yourself once it's inside the abdomen, and with the laparoscopic view, you would deploy the blade, and then you would cut what you need to facilitate removal of your specimen. The benefits of this knife are terrific. And for anybody who does a high volume of minimally invasive surgery, you know that the holy grail of minimally invasive surgery is to maintain your pneumoperitoneum. And so to be able to introduce a device down the trocar where you can cut the fascia without ever losing your pneumoperitoneum and your ability to visualize is very powerful. And it's something that we all tend to take for granted. There are no other devices in the marketplace that offer anything similar. And so we have found this to be very, very helpful in our practice. And I'm sure with time there'll be more uses and more indications for it. But certainly in the gynecologic world as well, where there seems to be an emphasis on cutting the fascia to remove a fibroid but not impacting the skin or making the skin incision any bigger, this is an ideal device for that. So I encourage you to try it. It's very easy to use, and like I said, it's a single-use device. There's no blade on the end, and the blade is completely retractable, and I encourage you to give it a try. One of the things that is brought up with the use of this knife and for extracting of specimens is that surgeons will say, well, I don't need this knife. And indeed, one does not need to have it, but it certainly makes your life a lot easier. As you know, traditionally, minimally invasive surgeons make small incisions and we do big operations. And in order to get a specimen out, you make the incision bigger, and you stick your finger in, and you're pulling the fascia and you're pulling the skin apart. And this is an alternative to that. The incision is very linear, and it also is easier to close with the fascial suture device that you use to close the abdominal wall. This certainly makes it easier because, you know, oftentimes when you stick your fingers in, you're pulling things apart. It's very irregular, it's very jagged, and this makes a very smooth linear cut that's very easy to close.